Hello. I'm so glad you came back in. So we put a mask on her hair and to bring up some of the flakes. And so she's here to get her hair deflaked, removing the flakes. And we're going to wash the mask out of her hair and also talk about how she's been managing her anxiety. So what's been happening with your anxiety? Because I know you talked about having social anxiety. So when did it start? You remember? Oh, in childhood. So would you miss a lot of school? Would you have social anxiety to go to school? Okay. So you would say it started then. So how would you get out of going to school? What excuses would you use? Okay. So you would tell your mom or your parent that you were sick. Did you feel physically sick? At times. Okay. That makes sense. A lot of people who are experiencing anxieties, especially social anxiety, talk about, having an upset stomach or a nervous stomach, a headache, which prevents them from going out because they really experiencing these physical issues, physical pain. So your parents dealt with it by taking you to the hospital, taking you to the doctor, and they would look and it wouldn't appear that anything was wrong. Sorry. So then at the age of 13, you said that you ended up at getting hospitalized psychiatrically due to the panic attacks. Okay. I'm going to move the camera up a little bit because we have a really big cluster up here. Is this where you get a lot of your itching? Okay. So then once you were diagnosed, was it easier to manage the panic attacks once you knew what you were dealing with? No? Okay. You just felt like it had a label. Okay. So what treatment options have helped you? What do you do now? Now that you're older, I know you said you still experience some panic attacks, but they're not as frequent or as severe as they were when you were a teenager. Mm-hmm. So medication has helped you. Okay. Are you consistent with your meds? You can be honest. Not all the way, not all the time. Okay. What happens if you miss your meds? If you don't take them? Do you notice an increase in your anxiety? Okay, then that makes sense. So you know the meds work when you take them. That's the key point, is to take them. And also use your other methods that you've learned over the years on how to manage your social anxiety. You know, I'm proud that you came for your appointment, as I know there have been appointments that you've canceled and later told me you were just struggling with your anxiety. Turn you around a little bit. You really have a lot of patches, dandruff in this center area, but I don't think I can get my camera in there. So I'll pull it out. You definitely have larger flakes. Have the breathing exercises worked to to limit the severity of your panic attacks when you're in social situations that are just overwhelming for you? Because I know you've been taking a few classes, which I'm very proud of you for that. Mm-hmm. So the breathing exercises have worked. Good. So I'm going to rinse you out now, get this mask off, get the rest of the dandruff flakes that are on top. Ooh. And I will see you at your next appointment when I get this all washed out.